Should eyelid surgery be done by a plastic surgeon or an eye doctor?
This is a question we hear often. If you want your eyes to look more open and refreshed, and you're hoping for a prettier appearance as well, then I recommend combining both functional and cosmetic surgery. Hello, I'm Dr. Ho from Eye Siblings, here to answer your question simply. Curious about double eyelid surgery, entropion, or ptosis? Then let me explain what you're wondering about.
Is double eyelid surgery covered by insurance if done at an eye clinic? Can it still look pretty?
Well, some cases are covered and some are not. If it's a diagnosed condition, it's usually covered by national insurance and private insurance. But if it's for cosmetic reasons, neither is covered. The main medical conditions include entropion, trichiasis, and ptosis. Regardless of the reason, the surgical methods and outcomes vary greatly. But the ultimate goal is to treat the condition, restore function, and achieve a beautiful eyelid at the same time. However, for those with severe ptosis, we often perform resection of the eyelid lifting muscle. This may result in the eyes not closing completely, leading to dry eye discomfort. That's because the rubber band-like muscle is already paralyzed, and some side effects are inevitable.
Should double eyelid surgery be done by a plastic surgeon or an ophthalmologist?
We get this question a lot, and honestly, both are fine. Just like in any profession, the person with the most experience becomes the expert. It's the same here. The surgeon with more hands-on experience is better. It's not about what department the doctor studied in. For doctors, these surgeries aren't particularly difficult. Those who've done it for a long time get really good at it. But ophthalmologists do have a few advantages. They specialize in eyes and have deep knowledge of the surrounding structures, so they operate with a full understanding of visual function. They also assess if the surgery is appropriate and safe. They check for any corneal damage caused by the condition before surgery, and the extraocular muscles that control eye movement, because they also evaluate any related nerve conditions. There's less risk of surgical failure due to misdiagnosis.
So what are entropion, trichiasis, and ptosis?
Entropion, also called inward-turning eyelid, it literally means the eyelid rolls inward toward the eye. Surgery isn't always required, but if the corneal damage is too severe, or if it leads to corneal opacity, surgery becomes necessary. In children, congenital entropion usually improves with growth, so we often just observe. But if corneal damage is too severe and affects eye development, then surgery must be done quickly, regardless of age. There are also age-related entropion cases in elderly patients, or scar-related entropion caused by trauma. Depending on the severity, surgery may be needed in those cases too. As for trichiasis, it can result from various causes such as follicle damage, which causes multiple eyelashes to grow inward, and misalignment of lashes scratches the cornea. This condition often appears alongside entropion. Depending on its severity, we may remove the lashes manually, or treat with electrolysis or radiofrequency, or resolve it through surgery. Ptosis is a bit more complex. It's also known as droopy eyelid. It can be caused by a number of factors, such as weakened muscles that raise the eyelid, which results in a lowered eyelid position. Entropion and trichiasis can affect both the upper and lower eyelids, but ptosis only affects the upper eyelid, which makes it more difficult and complex to treat.
How is entropion surgery performed?
For entropion surgery, we remove a portion of the skin and muscle under the eyelid, then suture the lashes downward to fix their direction. This turns the eyelid outward. Patients with entropion, their eyelashes curl inward, making their eyes look smaller than they actually are. After surgery, the eyes appear bigger. And among entropion patients, many have inner epicanthal folds, which also make the eyes appear smaller. In such cases, our patients often desire a more open and refreshed eye shape. When entropion surgery is combined with medial epicanthoplasty, inner corner surgery, it elongates the eyes horizontally, making them look bigger. If you want a more open and refreshed eye shape and would like your eyes to look prettier as well, then I recommend combining it with inner corner surgery. Many patients worry about visible scarring after surgery. Healing speed and scarring vary from person to person. To minimize scarring, we surgeons make incisions along the natural eyelid folds and suture carefully. Over time, scars become barely noticeable. Now, when patients visit an eye clinic, they often worry, what if they recommend surgery right away? Some patients hesitate to visit because of this concern. But we only recommend surgery when truly necessary. For example, if there's a serious issue with the eye, or if complications have developed. Only in such cases do we recommend surgery. We don't push surgery on most patients. Only after a full consultation with the doctor do we recommend surgery if it's the best solution. So you really don't need to worry. As I mentioned at the beginning, entropion surgery is covered by national health insurance and private insurance. So please check your private insurance policy before the procedure. If you have any more questions, feel free to leave a comment anytime. The Eye Siblings will kindly respond after reviewing your message. This has been Dr. Ho from Eye Siblings. Goodbye.